If you are a federal retiree with access to federal employee health benefits, should you still enroll in Medicare? And if so, should you enroll in Medicare Parts A or B or both? Hi there, if we haven't met yet, I'm Danielle Roberts from Boomer Benefits, where every month we get questions like these from federal retirees. In this video, we'll discuss the options you have when you are eligible for both federal employee health benefits and also Medicare. Stay tuned for some additional FEHB resources that I'm going to give you later in the video, and be sure to hit that subscribe button if you find this video helpful. Throughout this video, you'll hear me refer to federal employee health benefits as FEHB. Typically, people with FEHB don't need our help here at Boomer Benefits because their FEHB already provides the coverage that someone else might need to get from, say, a Medigap plan and a Part D drug plan. However, in recent years, due to the expense of the FEHB plans, we've been getting more inquiries from people who want to explore the option of suspending their FEHB and enrolling in a much less expensive Medicare Advantage plan instead. But let's start by covering some of the basics. Federal employees who are enrolled in FEHB are eligible to keep that coverage into their retirement years. And the federal government pays approximately 72 to 75% of the premiums for retirees, or annuitants as they are called. There are a bunch of different FEHB plan options you could choose, including fee-for-service, HMO, PPO, and high-deductible plans. However, even though you have FEHB, federal annuitants are still encouraged to enroll in Medicare at 65, as those Part A and B benefits can coordinate with your FEHB to reduce some of your out-of-pocket medical spending during your retirement years. If you have Medicare and FEHB, you do not need a Medigap plan because FEHB already serves as a sort of wraparound to your Medicare. Here are a few different ways that you can structure your benefits once you turn 65 and are eligible for Medicare. Option 1, you can keep your federal employee health benefits and enroll in Medicare Part A, but not Parts B or D. This option allows you to keep the FEHB that you already have without having to pay any additional premiums for Medicare. Most people qualify for premium-free Part A because either they or their spouse have paid FICA taxes during their working years, which have made them now paid up for Medicare Part A. This means it costs you nothing to add Part A, and it may help you if you have any inpatient hospital stays. However, if you only enroll in Part A and not B, you will pay many of your own FEHB copays out of pocket. So on the one hand, you'll be saving the money you would have spent on Part B premiums, but you're going to be paying your own copays for various healthcare services such as doctor visits and diagnostic scans, surgeries, urgent care, ambulance rides, and so on. You'll want to weigh the cost of paying the monthly Part B premiums against the cost of paying your own copays out of pocket. If you tend to use a lot of medical care, it might make sense for you to pick up Part B so that it could pay those copays for you. Another downside of this option is that if you don't enroll in Medicare Part B when you're first eligible and later you decide you want it, you'll be subject to a 10% late penalty for every year that you could have been enrolled in Part B but were not. We run across people all the time who regret that they didn't enroll in Medicare Part B when they first retired. Option 2, keep your FEHB and enroll in both Medicare Parts A and B, with Medicare as your primary coverage and FEHB as your secondary coverage. In this situation, you are paying for Medicare Part B and for FEHB benefits, but the advantage is FEHB is covering the 20% coinsurance that Part B normally doesn't cover, as well as your Medicare deductibles and copays, which will ultimately leave you with very little out of pocket. You can see any provider in the nation that takes Medicare, and there are over 1 million of those providers, and you would not need to enroll in Medicare Part D since your FEHB plan already includes drug coverage. This option provides fuller coverage than the first option, and although you'll be paying premiums for Part B, that is somewhat offset for the fact that you don't pay 100% of the cost of your federal employee health benefits. Remember, the government is picking up about 2/3 of those premium costs for you. Lastly, if you received any services or medical equipment that Medicare typically doesn't cover, then your FEHB will likely step in to pay for those items for you. So this option, all in all, is pretty robust. Option 3, you can enroll in Medicare Parts A and B as your primary coverage and suspend your FEHB temporarily with the option to re-enroll in it in the future. If you went this route, you could then choose a Medicare Advantage plan so that you have affordable but also comprehensive medical coverage. We often see people do this if they determine that enrolling in this coverage would be less expensive for them than keeping their FEHB active. Advantage plans are very popular, with more than 42% of Medicare beneficiaries choosing them for their coverage. And in many urban areas, you can find Medicare Advantage plans with a zero premium, which means you pay nothing more for the plan other than what you already pay for Part B. These plans often include attractive extras too, such as dental, vision, hearing, gym memberships, and more. If you would like to explore options for Medicare Advantage plans in your area, give us a call here at Boomer Benefits. Our service is 100% free to you, and we'll be glad to help you determine if one of these plans makes sense for you. I'd also like to point you to several government websites that offer great information for federal retirees. Please be aware as well that the information in this video is general, and some of what I've shared here may be subject to change if you are viewing it in the future. There are also nuances that may apply in certain scenarios or depending on which FEHB plan option you ultimately choose. You are responsible for researching your own options for FEHB. So with that said, I'd like to point you to several government websites that offer great information for federal retirees. And you can find that information below this video. The OPM website contains all the information you may need about various plans offered in each state and has a comparison tool as well to help you choose. Thanks for watching, and we'll see you in the next video.